Thank you, Dr. Mittal, for joining us, and heartiest congratulations for the third edition of the conference.
Thank you so much.
So, what is your philosophy at Lab to Life ART Fertility Clinics?
So basically, we feel at India level that fertility services needs to improve.
Right.
There is definitely a lack of knowledge, lack of awareness, both at the level of doctors and at the level of patients. Keeping that in mind, what we have tried to do is that the best of fertility services across the world, we have requested them, and through them we have opened up in India. Now at India, what is the difference which we feel is primarily, one is the lack of knowledge and awareness in doctors. Second is also at the embryology level.
Sure.
At the embryology level in India, still there is no much awareness. If you go and see the clinics, in majority of our Indian scenario, the lab is given the least priority in terms of space, in terms of everything else, technology, leading to a problem that although we can get a good quality egg or sperm, but we are not able to convert that into a good life,
right,
because the lab is not up to the mark.
Okay.
There is a pollution issue, there is an issue of how do you maintain the temperatures and others. So now there are a lot of technologies which cost a bit, but if we need to do that if we want to improve the outcomes after the IVF cycle has happened. So I think that is why we say that lab to life. We feel the embryology lab is very, very critical, along with the clinical science which is important.
Fantastic. So talk to us about your partnership with MOGS.
Yes, for the partner with MOGS, we feel that this awareness needs to spread both in the doctor fraternity as well as the patient. So on the doctor fraternity, they need to understand and learn what is difference between an average level of IVF happening versus what is a good quality. And MOGS partnership helps us in that, because a lot of gynecologists are associated with that. And when we approach them, they were very, very helpful with us, because this is helping us reaching out to the right set of clinicians, right set of gynecologists, and that's why we associated with them.
All right. So what are the risks and challenges involved with the treatments?
So the risk primarily is of not knowing what we are doing. As Professor was saying, majority of our doctors, which we see in Indian scenario, the prescription includes everything on the earth. So it's a very, he uses a word called cooking biryani technique. Right. He says there's such a lengthy prescription which you give it. That's one. Second, it is not one size fit all. And what we have noticed in currently with majority of the doctors is that for every patient, it is the same treatment protocol. What ideally should happen, it should be a personalized treatment so that we do no harm. So that is what we feel is the most important thing in case you want to reduce the risk factor of it. Risk only comes when you are doing something which is not needed.
Right.
And so what we do at ART is that we first understand the reason. We make sure that we give only the treatment which is needed and not giving 10, 20, 30 medicines. Third, what we also do is, after giving medicines, there is a regular follow-up,
right,
which we have noticed currently in all other places is, there will be a start investigations, and then there is a 10th day after hormones is finished and investigations. In between, what has been the response, we don't know. Ideally, we should do in between so that we can titrate the dosages of hormone, or we can stop the hormones if it is not responding. That will reduce the risk completely as far as the patient risk.
Yeah, it's a journey, it's not a destination.
Yes.
How do you compare Indian versus overseas and geographical conditions?
Oh, geographical condition, if you talk, Indian population, women starts, their egg reserve starts deteriorating very rapidly after 35 years of age. What we have noticed is our Indian population is 6 years faster going downwards compared to Spanish population. That's the study which is there.
Right.
So we need to be more aware, and we need to be alert faster. The Indian women's are now changing rapidly, and they are in every field which is there. So they have a work-life balance which is there, and also they need to be mother. So I think they need to be well aware, well in advance, to preserve their eggs so that they can manage both, the work also and also the life at the later.
And what is the success rate of these frozen eggs?
Oh, it's as good as the normal ones, which is there, right? It's completely normal. It's like normal ones, because you have frozen the egg at the right age, those are the best quality eggs. So results are as good as the 25 years or 30 years.
So you create lives. So which is the best gratitude message you've ever got?
No, I would only say that, rather than message, I will just say the embryology lab is very, very critical.
Sure.
I, as a oncosurgeon, I always felt that, when I see those labs, when I've gone, I see them as one day life which is there. Normally when the baby is born, it's 9 months, right?
Yes, yes.
So the embryologist manages that one day life.
Right.
So just imagine, those are like small beds, ICU beds, we see the babies when they're born not well. There are so many lines and we feel very, very sad to see all those. Just imagine they are managing one day cell, which is a live cell. So that needs even more care, and their needs is more of oxygenation, their needs is more of pollutants not being there, temperature being monitored. I think they do wonders. So that lab to life is it's a very something touchy thing which is there from my side. I think we need to. That's it.
Absolutely, truly appreciate the wonderful work you're doing and getting in the new generation. Your final words for the aspiring couples.
I think don't lose hope. There is definitely a lot happening in this world, and there is definitely a solution for everything. They should avoid, as far as possible, looking for donor cycles and surrogacies. First, try your natural ones, which is possible, and go to the right doctor. That's all.
So believe, hope, and conceive.
Yes.
All right. Thank you so much, Doctor.
Pleasure.
It was a pleasure.